Good morning, good evening, good afternoon, whenever and wherever you're joining me from, welcome. Welcome to the first video in a series of 5 regarding the topic of death and dying. I'm here to help you dispel some of the myths and some of the fears involved in the death and dying process. So the first video talks about the basics, about what is actually death, and some of the top questions that are asked regarding the process and regarding death and dying in itself. This is for the people that are actively dying or people that are the caregivers and surrounding the people. So, what is death? Death is the physical body ceasing function. So there's no more eating, there's no more drinking, you're not breathing, there's no brain waves, there's no brain activity, and there's no heartbeat. And other organs fail. So that is physical death. That is the definition of death. So some of the questions that people have are, why is this happening to me? Or why is this happening to my loved one? This is the most common question that people face, that people are asking about when they're facing death or the death of a loved one. But it's not really a question. It's more of an expression. It can be an expression of shock or anger or fear or deep sadness. And there's not a typical theological or medical answer that can be given to that kind of thing, because it is very personal. It's very individual, and it's based on how you grew up or what your belief systems are now. Maybe you grew up super religious and there's a heaven or hell. Or, maybe it's karma. Maybe you feel like it's karma. It's not karma. There is such thing as karma, absolutely. But your death is not karma. So, and there's no one way to feel about it. There's no right or wrong answer on why it's happening. It's just a matter of individual perception. What do you think about it? What are your thoughts? How do you feel about that process? Where do you think you're gonna go? What do you think's gonna happen? Why does it happen to us? It's just a part of the process. It's a part of life. Life comes to an end at some point. But it's really important to know that you need to express those concerns and express that process, whether it's grief and shock and sorrow or anything. Express it. Express it to the people around you, to your loved ones, and express it to yourself. So, who do you express that to? Okay, your family, your friends, and even your death doula. So I am in death doula, and I'm also a medium. So the role of a death doula is to support you in that transition phase. So your planning includes everything from what you want to say to your loved ones, what you want to say to your kids, your sister, your brother, your aunts, your uncles, whoever it may be. That the death doula is there to help you process your own feelings and process the feeling and to display your emotions and your concerns with your family if that needs to happen. If you're not comfortable doing that by yourself. Another question is, what even comes next? What's next? Are we going to some kind of an afterlife that we grew up with? Where are we going? So at the end of life, people are usually looking for new answers to the old age question of what happens after we die. Instead, they want to think about the life that they lived and what they have known in the past. The death doula supports that reflection, either directly or by going out into the community and finding what they need. So, oftentimes, the person that is actively dying isn't really that concerned on the majority, on the large spectrum. People aren't concerned with the dying process when you're actively dying. They're more concerned with regrets or memories, positive memories, or anything like that. It's us. It's the ones who are not currently actively dying that fear it the most. So what do we do about that? How do we learn about that? Well, you watch videos like this, and you watch videos from other death doulas. You watch videos from other people within the field. You do research. You read books on the process. And that's if you want to no longer fear it. That's not something you have to do. Nobody has to do anything. But those are some steps that can help manage your fear around the subject of death and dying. Another thing people want to do is they want to tell their story. People who are dying or those who are losing a loved one often want to go over the story of their life and their illness. The death doula is there to let them tell their story, whether it's from the beginning or they just want to go over the diagnosis, where they were when they heard it, or what happened next, any number of times. So as a death doula, you may hear their story 10 times, and it's okay. Let your patients tell their story. Let your patients talk as much as they want, and you can help them by, maybe they're no longer verbal, so maybe they can only write things down. Let them write, help them write. So speaking from family members, just talk to your loved ones. It's okay. Don't hide things. Don't try and be super positive. It's not a positive thing always. Okay? Let's have realism. It hurts to lose a loved one. It hurts. It's okay to say that. However, you gotta say the things that you need to say. All good, all possibly bad, maybe forgiveness, things like that. And also, forgiveness is not necessary. If you don't want to do it, don't do it. But express what you want to express. You want to keep things to yourself, that's totally normal and totally fine. But the things that you do want to express, please express them. And your death doula is there to help you do that as well if you need. The death doula is also there not just for the person actively dying. We are there for the families as well, the caregivers and the support teams. So there are a number of ways that you can tell your story. So like, as I've already mentioned too, you can talk about it, you can say it verbally, you can write it, you can draw it. If you're an artist and you tell things and you express yourself through artistry, do it. You can do a video audio recording. You can have that done and you can have that prepared for the people after the passing. For example, my mom left us messages she left messages for after she passed, and we knew about them after. It makes people feel good. It gives them a sense of closure sometimes. It can give that. So you can do those, and then you can just talking, recording, writing, any way you want, any way you feel, any way you see fit. It works. Another thing is, and I've already mentioned this, people have regrets. What do we do about regrets? If your loved one is dying, have you said everything that you need to say to them. The death doula is there to help you prepare for death by encouraging you to write letters or sit down with people and make peace by saying what you've been wanting to say. So exactly what I said before. You just talk about it. It's not scary, it's not bad to talk about it. It gives you that peace. Even if your loved one is very near death or not even conscious anymore, people who are dying are often aware of what you're saying. So if you think my loved one is in a coma now, it's too late. They can't hear me. It's over. It's too late to have said everything that I need to say. It's really not. Hearing is the last sense to go, and oftentimes the soul hears the messages post-death in the first moments, because there's still somewhat brain activity after the last breath. They still hear you, and it's never too late to say I'm sorry, and it's also never too late to say I love you. If that's what you wanted to say it. They will hear you. Some other concerns around the death and dying process is, what about my family? So everyone facing a death of a loved one copes differently. Some family members will accept the news more easily and find it difficult to be patient with others who are in denial. So the death doula or the religious leaders or whoever you choose to be there with you can help families understand that everyone takes this information at a different pace. Some people need more time. It's a shocking news when you know somebody you love is facing the end. In some families, old anger and hurt bubbles to the surface when death is near. So the death doula is there to help someone removed from the family. They're there for you as well. Yes, like I said before, we're there to help you in the grieving process of your loved one. You don't have to be in the room. If you're someone that's far away, we support you as well. If you need that, if you know about it, if you know your loved one is getting death doula services, you can reach out to your loved one's death doula, and we can help. We can help bridge that gap if needed, if wanted. So we can be a safe and neutral facilitator to help you talk out your issues. Even if your family doesn't have any religious or other faiths, death doula is there for you, and they can be very helpful in bridging that gap and making those that final piece for both of you, not just for your loved one dying, but for you as well. And that's another thing about being a death doula, is that we are non-religious. Our personal faith does not get involved in your process. We are open to every process. We are open to every culture possible. If we don't know about it, we learn about it. So we're there as a purely neutral party. We're there to help you and your loved one transition and make the death process as easy as humanly possible. So, what happens when death approaches? People are often anxious about what to expect when death approaches. But your care team, including the doctors, the nurses, any social workers, and the death doula, or any chaplains, can help you prepare for the stages of death and dying. These stages can vary depending on the type of illness and other factors, but these are the most common, most seen circumstances. So as the body's systems weaken in the months before death, people tend to be less active, and they begin to start looking inwards. They start to doing some personal reflection on, do they feel like they did enough? What do they want from their process? What do they want for their final planning, etc.? They start to withdraw from the world around them, and they often use the stepping back as a way of preparing. That helps them, like the physical body. When the physical body is starting to die, you stop eating and you stop drinking, things like that, because your body is getting prepared for its death. You don't need nutrition anymore. You don't need water anymore when you're actively dying, because it just hurts the body. It just prolongs death. So your physical body is a brilliant system. And so it's the same thing with this preparation, for mental preparation. Again, people become less interested in food as death approaches. It may seem weird, but even though one of our main ways to comfort people is to feed them, there comes a point when the body is simply not able to digest the food that's given. So food and water prolong life. And things might start to happen, like they may lose function of their throat. They may not be able to swallow. Your body's going to physically reject anything going into its body because it knows it can't survive anymore. Just be prepared for that. It may not look pretty, but your care team is there to help you process that, and your care team is there to help your loved one be as comfortable as possible. A couple of weeks before the death, people can become very disoriented. So days and nights may switch, and sometimes they can't keep their eyes open. Other times, they can't sleep at all. This is particularly hard on caregivers. It's hard to watch your loved one either sleep all day or to be so agitated and they can't sleep at all. It's so painful to watch that. Just know that it's there, and your death doula is there to support you through that. And your death doula is there to support your loved one through that process. And finally, during the week or so immediately prior to death, you'll see physical changes. So their pulse and their breathing will slow down, their blood pressure is going to drop, and their skin color is going to become a duskier color. They'll be pale, they'll be almost grayish sometimes, and depending on the disease, depends on the disease process. They could have a yellowish skin tinge, which would be jaundice, which would be a liver condition. So it's going to look different. And then within a few days or hours before the death, there's this phenomenon that happens. It doesn't happen in every case, but it happens in a significant amount of cases where the professionals call it a terminal agitation. So it's kind of an energy, like it's a restlessness, and they may say things like, I need to get out of here. I need to go home. They may feel like they're in a hotel and they just want to go home. That's the death process. That's when you know they're probably a couple of days at most away from dying. This usually happens as it lasts. It's kind of like a rally. The body's just a surge of energy and just preparing. So if your loved one is experiencing this and they're deeply confused or distressed, the care team can offer a sedative that will ease this transition. It's a symptom. It's not necessary. If they're upset by it, then absolutely. But hear the words that they're saying. There is messages in between that. But just let them be as comfortable as possible. If you feel that decision, then do it. Your death doula will call the care team if that happens. So most people with terminal illness become unconscious in the last few hours or even days before death. So after this rally, they tend to fall into their coma or unconsciousness and unawareness. So they may not be aware of what's going on, other than hearing. So most people, so they know that you're there. They don't necessarily not know that you're there, but they're not going to be there to you. You may feel like they're not with it and you don't think that they know anything that's going on. They do. It's just, it doesn't look the same for you. So many palliative care and hospice professionals will tell you that hearing is often the last sense to go, and remind yourself of that. Long after your loved one is in that state, you can say, I love you. They will hear you. Support for you and support for your loved one. If you've been diagnosed with a serious, long-lasting disease or with a life-threatening illness, palliative care can make your life and the lives of those around you much easier. Families, please allow your family member to take the medication. Morphine and Dilaudid and these other medications that are there are not killing your loved one faster. I promise you this. All it's doing is making them more comfortable in that passing, in that death. It just makes it easier to slip under. I know it's difficult. It's not easy. You don't want to see your loved one in that process. And maybe you're worried about addiction. If they had addiction issues in the past to substances like this, just let them take it for their own comfort. So some of the ways the palliative care team can support you is there's a focus on relieving the pain and other troubling symptoms. We're also there to meet your emotional, your spiritual, and your practical needs. In short, the medical specialty of end-of-life care aims to improve your quality of life, however you define that for yourself. Your care team will your providers will work with you to identify and carry out your goals. So obviously symptom relief, counseling if you need it, because it's a hard thing to embrace and to accept. So, and then spiritual comfort in whatever way that you feel is necessary. So palliative care can also help you to understand your treatment options. One of the strengths of the palliative care team is the recognition of the human side of illness. So doctors themselves and people that are not in the death and dying process, if they're not in hospice or if they're not in palliative care, their main focus is to keep you alive. Their main focus is to save lives. So they don't really have necessarily the time all the time to take care of your needs, your spiritual needs, your fear, your anything like that. So the palliative care team has a little bit more time to do that. Further to that, your death doula is there for you 24/7 whenever you need them. You work that plan out with them, with each individual doula, but sometimes a lot of them are on call and will be there when you need them to be. So they can help that process. They can help you with those things, and they can help you get those resources. So maybe the palliative care team does have that time to spend with you, but maybe they're super busy. Maybe they have 20, 30, 40 charts right now. So they might not have time exactly, or they might miss something. So if they do miss something, your death doula is there to provide that support and to get the support that you actually need. So if it's missed, they can find it for you. Be assured that you can receive palliative care at the same time that you pursue a cure for your illness. It doesn't mean that you're giving up if you're entering palliative care. It just means that you'll have a little bit more support from regular doctors. And you won't be required to give up your regular doctor treatment or hope for a cure. It doesn't mean you're giving up. It just means that you're gonna have access to more support and more care and to a different level of care. So that was the first segment. If you like this, give it a like, give it a share, and ask any questions you have. If you have any questions, put them down and I will try and answer them in the next videos. The next videos, some of them will be on the perspective of a medium. Thanks.